The following segment is sponsored by Optum Utah. A stroke can happen in an instant, and every second counts. Dr. Gordon Harkness is here to share the signs you should never ignore, who's most at risk, and the simple acronym that could save a life. Welcome back to the show, Dr. Harkness.
Thank you. Thanks for having me.
Great to see you. Okay, so what is a stroke? Let's just start there. And there are two types, and what causes it?
Yeah, so a stroke is basically something that causes damage to the neural tissue in the brain. Okay. Think about a heart attack. It's a heart attack that's damage to the muscle of the heart. Well, with a stroke, it's the brain instead. And there's two types. It can happen from getting a blockage in the arteries in the brain that can lead to the tissues not getting enough oxygen. Okay. Or you can have a bleed that puts pressure on the brain tissue itself. So there's two different types, although you can't really distinguish it based off of the symptoms that you might have.
Sure. Okay, what are the signs or symptoms, like you said, of a stroke?
Yeah, usually it's a pretty sudden onset of different symptoms depending on what part of the brain is being affected. So sometimes people might experience slurring of speech. Okay. They might have weakness or numbness. Somebody might look at their face and see that they're drooping on one side. It can be vision changes. It's neurological things, and it's a sudden onset. It's out of the ordinary, out of the blue, and it's something that you don't want to ignore.
Sure, and can happen so fast.
Yes, exactly.
So quick. Okay, what should we do if we think someone is having a stroke, maybe ourselves or somebody else?
Yeah, you've got to get to the hospital. Time is of the essence in a situation like this, so don't wait around and try to figure out what's happening. Probably not worth calling the doctor's office either, because they're just going to send you to the emergency room. You got to be evaluated and seen at the emergency room. There's certain treatments that can be done in specific situations, but they're very time sensitive, and so if you wait too long, those treatments aren't helpful and won't be used.
Okay, yeah, because some people may think, oh, I'm going to call the doctor before I just head in. What if it's nothing, you know? But if you think you are having a stroke, they're probably just going to send you to the ER anyway, exactly, like you said. Okay.
Exactly.
What can happen when someone suffers from a stroke? What are the consequences, like if we don't get there in time?
Yeah, so those neurological things that we talked about, the symptoms of the stroke, the numbness, the weakness, the slurred speech, that type of thing, in some cases they can become permanent, and we don't want that to happen. Yeah. But you know, when somebody's had a stroke, what we hope is that those symptoms will resolve over time. Sometimes they do, sometimes they don't. And again, the thing that's most important is the best chance you have for recovery is making sure you get to the hospital as soon as you can.
As soon as you can. Okay, what are some ways to help prevent a stroke? Is there prevention? Yeah,
well, there's certain conditions that are associated with stroke. So people that have high blood pressure, as an example, diabetes or heart disease, high cholesterol. So if you have any of those conditions, one of the reasons why we want to treat those things is to prevent consequences like a stroke. So making sure that you're seeing your doctor regularly, taking those medications that you're supposed to be on to try to prevent, plus healthy living. You want to make sure you're exercising regularly, you're eating a healthy diet, you're doing those things that you might not think are going to have a big effect on you in the day-to-day living, but can have a long-term effect in terms of overall health.
Yeah, and help prevent this possibly.
Yes.
Where can we go for more information with you guys?
Yeah, optum.com/Utah is a good source of information.
Okay, thank you so much for being here. We learned a lot. Thank you. I appreciate you, Dr. Harkness.
Thanks.